Hi there, my name is Dr. Zurlinden. I'm the veterinarian here at the APS of Durham, and I'm recording this presentation to discuss fostering a heartworm-positive dog. All the pictures of the dogs in this presentation are dogs that we have treated here at the shelter. So first of all, thank you so much for your interest in fostering one of our heartworm-positive dogs. We really appreciate your dedication and your compassion to provide them a safe, comfortable place to undergo this treatment. We truly can't do it without you. This presentation will include some information about heartworm disease in general, details about the treatment that we're able to provide here at the APS, what recovery will look like from treatment, and who to contact with your concerns or questions. So what is heartworm disease? It's a serious condition that results from infection with the mosquito-transmitted parasite Dirofilaria immitis. Heartworms live in the heart, lungs, and blood vessels of affected dogs. And the damage that the worms cause can result in serious illness or even death. Heartworm disease can occur in dogs, cats, and ferrets. It affects each species differently, and there's no risk for human transmission. Heartworms have a really complex life cycle, and their life cycle takes several months to complete. You can see on this diagram how complicated it is. And if you want some more information on it, the American Heartworm Society has an amazing website with a ton of resources. But it's important to know that dogs can be bitten and infected with heartworms multiple times by multiple mosquitoes. And once a dog is treated, it's still really important to continue the preventative measures for the life of the dog because they can become reinfected. And while there's no direct transmission to other dogs, so one dog cannot give heartworms to another dog, it is possible for an infected dog in a household, shelter, or neighborhood to serve as a reservoir of infection. So a mosquito could bite an infected dog and then go bite a dog that's not infected and cause disease. So, how do we diagnose heartworm disease? We can look for clinical signs, and we categorize these as mild, moderate, or severe. So, in mild cases, we might see no symptoms at all, or we might just see some coughing. In moderate cases, we might see some exercise intolerance and some coughing as well. In severe cases, which we really don't like to see, we'll see coughing, exercise intolerance, difficulty breathing. We might see fluid in the abdomen if they're in heart failure. We might see fainting episodes, and unfortunately, this can even be fatal. Here at the shelter, we use point of care SNAP tests. This test detects adult heartworms, so the animals must be 7 months of age for us to test them. And we also can do some microscopic evaluation to see this picture here, microfilaria, which are basically baby heartworms. Okay, so now we're gonna transfer into treatment. So successful treatment of heartworm disease eliminates all the life stages of heartworms and prevents further internal damage. It's important to know that the damage that's already inflicted can affect a dog's long-term health. So they might have long-term exercise intolerance and things like that, even after they go through treatment. There's many different protocols to treat heartworm disease. These are really, really clearly laid out in the American Heartworm Society guidelines, and there are a lot of spectrum of care approaches, which is what we use at the Animal Protection Society. So for us, from the time of diagnosis to when they finish treatment is approximately 5 weeks. And once they're finished with treatment, they're eligible to finalize their adoption. It's important to know that because of legal restrictions, we cannot provide care for owned pets. So once they're adopted, the owner needs to follow up with their primary veterinarian to seek care. And it's really, really important to follow up with a vet soon after treatment because for successful treatment, it requires months of recovery, and you need to continue the heartworm prevention for the best success of treatment. Also, dogs are not retested for heartworms until about 9 months post-treatment. So, treatment consists of three main categories. So, first, right after they're diagnosed with heartworms, we will start them on doxycycline. This is an antibiotic that they take by mouth twice daily for 30 days. And what this antibiotic does is it weakens the adult heartworms because they have a bacteria on them called Wolbachia. And by giving this antibiotic that kills that bacteria, we're weakening the worms, which is going to make our treatment more effective. Sometimes we'll see some GI side effects like diarrhea or vomiting. If this is seen with the antibiotics while the dog is in foster with you, please contact us. We might need to lower the dose. The second part of treatment is melarsoline injections. This is the mainstay of treatment that's going to quickly kill adult heartworms. So, we provide two melarsoline injections, which are given 24 hours apart. We do this while the dogs are sedated, and this is because it's an injection that goes really deep into the muscle of the lower back. And with this two injection protocol, we expect 90% of dogs to be heartworm negative within 9 months. It's important for us to let you know that the full American Heartworm Society protocol consists of three injections. This protocol takes longer and it has a better success rate because it is the gold standard treatment. 96% of dogs on that treatment are negative within 9 months. However, as a shelter, we are really proud to be able to provide melarsoline treatment. It is really expensive, and our goal is to get animals out to loving homes. So we have found the balance with providing good care to our dogs and reaching our goals of adoption with this two protocol regimen. And if you dig into the American Heartworm Society guidelines, there is a spectrum of care section that discusses this protocol that we use. The third really important part that sometimes gets overseen and forgotten with heartworm treatment is to continue the monthly heartworm prevention. So we'll provide this once under our care. Once an animal's adopted, though, it needs to be filled through a primary veterinarian. And why this is so important, first of all, it's going to prevent further heartworm infections, but it also works to kill different life stages of the heartworm, so it's going to make the treatment much more effective. Of course, we need to talk about complications that might arise from heartworm treatment. Because the injections are done in the lower back, in the muscles, they might experience soreness, some swelling, and some tenderness after the injection. We do put some ice on it as they're recovering, which seems to help, but we do find that dogs tend to be pretty sore for a few days. If they're excessively painful or if you see any discharge from where the injections are, you need to seek immediate veterinary attention. One of the complications we can see occasionally is an abscess or infection at that site. Sometimes we also will see lethargy, depression, vomiting, diarrhea, or a decreased appetite following the injections. If this is persistent or severe, please seek immediate veterinary attention. And though rare, severe complications can occur. If any of these signs are seen, the pet needs to see immediately by an emergency veterinarian. So this would be a pulmonary thromboembolism. And basically, what this is, as the worms start to die off, pieces of those worms can travel to the lungs in the blood and cause blockages that can be life-threatening. And signs of a pulmonary thromboembolism would be a worsening cough, coughing up blood, difficulty breathing, and fever. Also, sometimes even despite treatment, dogs can go into heart failure. They can experience something called caval syndrome, where basically a big clump of worms get stuck in the right side of the heart and can be fatal. And also, they can have severe allergic reactions to the melarsoline. So after the dogs get their injections, we will be sending them home with a few medications. The first medication they'll be sent home with is prednisone. This is a steroid. It's an anti-inflammatory medication. It will help with the pain and swelling at the injection site itself, but it also will help control the inflammation that is caused when the worms start to die off rapidly. The second medication that we send home with every dog is gabapentin. This medication will help facilitate activity restriction. It's a calming medication. And depending on the temperament and activity level of the dog, we might prescribe some additional calming medications on a case-by-case basis. It's also, again, just to reiterate it, continuing monthly heartworm prevention is really important. And while the animal's under our care, we are able to provide this monthly. Activity restriction is really, really, really important after their injections. So it needs to begin immediately after the first injection and continue for 8 weeks or 2 months. And what this looks like is short, slow leash walks. So 5 to 10 minutes, 3 to 4 times a day. The goal is to prevent heart rate increases as much as possible. At other times, they need to be confined to a smaller space, like a crate or a smaller room. During this time, of course, we need to care about their mental wellness. So it's important to provide enrichment activities and give them a lot of attention. We do have a behaviorist on staff, so if you feel like you need any extra support in this area, please reach out and we would be happy to help you. It's also really important during this activity restriction period to be mindful of weight gain and adjust their diet as necessary. This can be guided by a veterinarian as well. Prednisone, the steroid, can cause increased appetite, which can lead to weight gain. And when they're activity restricted, of course, that can lead to weight gain as well. We also have crates available if needed. Please just ask. So, what does adoption look like for these guys? The dogs are eligible for adoption once they've received their second injection. We will provide 1 month of oral heartworm prevention and 1 month of gabapentin and prednisone at the time of adoption. However, once they're adopted, the new owners must follow up with their primary vet or emergency vet post-adoption if any complications arise. Because of this, we highly recommend having a veterinary care plan in line prior to adopting. We will provide you with a copy of this form. This is the levels of medical urgency for fosters. So you can see up here we have our emergency foster phone number that's monitored 24/7. This is really for emergencies only. And depending on the emergency, you might be asked to bring the animal directly to the shelter, or we might ask you to bring it to our emergency partner. If it's not a urgent medical concern, we will ask you to email us or call our phone and leave a message at the shelter. We also have a QR code here to schedule appointments or medication pickups. And that's all I have for now. If you have any questions, here's who to reach out to. If you have questions about fostering, you can reach out to Larissa at the email listed here. If you have questions related to adoption, please reach out to our adoption team. And if you have any medical related questions that are not urgent, please reach out to our medical team at the address here. Thank you so much for your time and have a great day. Bye-bye.